Okay, today is one medicine, Argentum Metallicum. And it's interesting because today I was on a call and my wife, like I said, I did phosphoric acid, and that's why I'm running late. I was on this call, and kelp carb seemed to help. Phosphoric acid seemed to help with the pain in the legs and that. But Ruta is definitely tendons and Russ talks. I was starting to think Russ talks because my wife said, her feet were aching when she got up and started moving around. It was better. That's a Russ talks situation. Ruda, and the homeopath from England, he said, yeah, this Ruta is, how long do you have her on Ruta? I said, about a month. So I don't think I went with Ruta long enough, and I'm backing off to a lower dose. So that may take care of that nodule or whatever she has on the bottom of her foot. Now, the calc carb helped with the aching in the legs. The phosphoric acid helped with the, aching also. That one really helped. So Tony, the guy I was with, Tony Hurley, he said, yeah, let's look. Why don't you look at calc phos? So that kind of puts those two remedies together. So them last ones I went over was Argent, Argentum cyanatum and Argentum iodatum. So that is taken iodide with silver, and the other one is taking cyanide with silver. So that's why if you try individual remedies, like if I tried iodide for a situation, and I tried if I tried iodatum homeopathically for a situation, and it seemed to help, and I tried argentum, which is silver, for that same situation, it seemed to help, then you go with argentum iodatum. So now I'm looking at calc phos for my wife, but I'm going back to Ruda and Russ Talks. One of those two. I'm not sure which. He was saying alternate, like do a Ruda at night, a Russ Talks in a day, or something. I'd have to look and see which one's better at which time of the day. And it'll tell you that in these things. But today is Argent Metallicum. Now, he says it's the Luna of the alchemist, so moon. So they relate everything to the moon, the sun, the stars, whatever, the planets. So Argentum Metallicum corresponds to deep-seated insidious disease in the mental sphere. So it's a lot of mental stuff with this one. And that's the moon. They say, is mind and moon, all that. So anyways, in the mental sphere, it affects the intellect more than the disorders. So the intellect really gets messed up more than any of the problems physically. Headache of businessmen, left-sided. Headache as if brain substance. Now, when they say businessmen, a lot of worry, a lot of stuff like that. So anybody worrying. It doesn't have to be a businessman, a businesswoman, a housewife that does a lot of worry and things like that. Headache and dyspepsia induced by mental agitation. Dyspepsia is a heartburn, so there's these headaches are gastric headaches, basically. So they're associated, that's a concomitant that is associated with the stomach, induced by mental agitation, nursing the sick, mental exertion. So nursing the sick, you're up all day, all night with the patient or person, you're a nurse's aide or whatever, or you have someone in your family that's sick all night and you're up all night. Mental exertion, the more deeply seated the troubles are, the more likely are they to be painless. So it's deep-seated problems, pains, aches, whatever. And the more deep-seated they are, the less pain they have. So that's very weird. So Argentum Metallicum, which is the metal silver. Cartilage, joints, so a lot of cartilage, joints, and bones, rheumatism and all these things, so they got bone pain, joint pain, cartilage, not only pain, but issues, things going on. Nerves, really good for the nerves. Epileptic attacks, so anybody having epileptic attacks, this could be a medicine that could be considered. It thickens the tissue, especially the cartilage. So that's where, the cartilage and all that comes in. This, if you overdosed on Argent Metallicum in homeopathic, or if you got poisoned by it, the tissues would get thickened. So this here would help with the cartilage and all that, and take them tissues and soften them up, and not have them so thick. Better open air. Cough lying at night. Hyoscyamus is opposite. It's cough in the morning, being up. So if it's lying at night, it's Argentum metallicum. If they just have a cough in the day when they're up and moving around, hyoscyamus. Worse touch, pressure, and worse at 3 to 6 p.m. So all the symptoms will come on period, I can't think of it. Periodically, well, sorry, but it'll come on 3 to 6 p.m. Worse speaking, mental strain, warm room, and sun. So they don't like to be out, and they don't like the warmth, they don't like the sun, and mental strain is definitely bad, and speaking is worse. They lose their voice and stuff like that. Periodicity or anyways, I'm trying to hurry because I feel like I'm late. I'm over a half hour late from that call, but there's no hurry. I just need to relax. Take it easy. Onanism is the causation, and sunstroke. So onanism is masturbation, and sunstroke, it's worse from, is the causation of whatever is going on with this person. Loss of control of mind, body, restless anxiety, moves about, and they're restless about their health. They're worried about their health. They have melancholy, which is like a depression, neurosis from worry. So they got this neurotic worry going on all the time. Cries with nervous loquacia. Loquacia is talkative. So this person's very nervous. They're talkative. They're going, and they have a lot of worry, and they're depressed, and they feel like they've lost control of their mind and their body. They're restless about their health, and they're anxious. So they have painful soreness in the abdomen, a distension going on with noisy rumbling. Feels like a worm coming out of anus. Now, I don't know why that's not down in the rectum, but it's up here. So they feel like something's wiggling out of their anus. They got a lot of rumbling, a lot of distension, painful soreness. So that's where that gastric headache comes from. They eat or whatever, and they get a lot of gas going on, a lot of disturbed stuff, and their belly becomes distended, and a lot of rumbling. And that's very interesting. It's not down in the rectum, but feels like worm coming out of anus. You heard anything like that? I don't remember hearing any remedy talking, having that symptom. Argentum metallicum would be the big one to consider. Severe backache, must walk bent over with oppression of chest, whether from lifting or whether they just have this backache constantly. It could be from their period. They got to walk bent over with oppression of chest, so they feel like they're breathing and everything. They got this oppression up there in the chest. Icy cold sacrum. So it's just, you feel their sacrum and it's icy cold. Argentum metallicum would be considered. Great weakness in chest. That's a 3 on the left side. So the left side of the chest got great weakness. Feeling of a raw spot in the suprasterna fossa. Now that yesterday, the one Argent, I don't know if it was yesterday. Yeah, it was yesterday, definitely. But I don't know which one had that. And that's that V-shaped bone right down in right here. That's where they get that raw spot. Oops. Dang it. Let's see. Itching of lobes of ears, scratch till it bleeds. So they're scratching that earlobe till it bleeds. Doesn't say one side or the other. Shooting pain in left spreads to brain. So they got this shooting pain in their head on the left side, and it spreads into their brain. Itching in the eye. Right ear is blocked. So the right ear they can't hear out of, it's blocked up. Itching eyelids and canthi. So they're just itching their eyes a lot. That sounds like I wonder if this one's for allergies and that. Purulent conjunctivitis. So that's that inflammation, or that, conjunctivitis is pink eye, basically. Keratitis, iritis. That is just inflammation of the eyes. So they got a lot of inflammation. They're scratching their eyes. They're scratching their earlobe till it bleeds. So a lot of itching going on up in that area. Face is pale, sallow, sunken, with weakness. Red, sudden heat with palpitation. So all of a sudden their face gets red, sudden heat, palpitations of the heart, pain in the facial bones. So the facial bones ache. Female, eroded, spongy cervix. That's a 3. So I'd imagine that affects having a baby. Menopausal hemorrhage. That's a 3. Leukorrhea. That's a 3. With foul, excoriating, bloody discharge. That's the leukorrhea. And they have bleeding during menopause and this cervix is eroded and spongy. They have a prolapse of the uterus with pain in left ovary, and they say in the reading it says that the ovary feels like it's really swollen up, and smaller back. So pain in left ovary and smaller back, extended to the front, so from the back to the front and down the legs, downward. Food, great hunger. Even when they eat, after they eat, they still got a great hunger. Hunger in the morning, giving nausea. So they wake up. That's a 3 too. Great hunger is a 3. Hunger in the morning, giving nausea. That's a 3. So they wake up, they feel nauseous because they're so hungry. 1 of thirst, even during a fever. So usually when you get a fever, you should be thirsty. But this one is, and there's a few medicines that have that. Head feels empty and hollow. That's a 3. So it feels like there's, it's just empty in their head. Dull neuralgia on the left side. So the head has nerve pain on the left side. A lot of left side, left ovary, left head, left pain in the left head, left side of the head. Where's another left? Left chest, great weakness. So a lot of left-sided stuff with this remedy. Exostosis on skull, which that's a 3, which means just an extra growth on the bones of the skull, bone growth. Boring headache, so it's like boring into their brain. Palpitations in the heart, that's a 3, especially during pregnancy. Better lying on left side, so they want to lie on the left side. Usually if you lie on the left side, that palpitation and all that gets worse, but this one here, they lie on the left side to make it feel better. Better deep inhalation, so they really take a deep breath to make things feel better. They're always kidney urine is profuse and turbid. Turbid means like dark colored and all that. Polyuria, diuresis, that's great. A lot of urination, a lot of urine coming out. And it has a sweet odor to it. It's yellowish green. So that's, and could be in diabetes, which is I'm coming to, basically, diabetes that usually has a lot of this polyuria, which is a lot of peeing and diuresis. So swelling of ankles in diabetes. So that one of these diuresis. Anyways, they're retaining their water. They're getting swollen ankles. Rheumatic disorders in the joints, especially elbow and knee. So anybody having elbow and knee problems, you might want to consider Argentum Metallicum. Arms feel powerless. Legs are weak. They tremble. Worse, descending stairs. Calves feel too short. Okay. Easy expectoration. Gray gelatinous. So it looks gray and it's thick, like jello. Cough from laughing. So when they laugh. Anytime they laugh, they'll have a cough right after. Hectic fever at noon. So what was it? 3 to 6 is worse. Everything's worse. But this here, they get this hectic fever at noon. And that's, hectic. Anyways, I'm not going to explain that. Fits coughing with violent expectoration of mucus like cooked starch, which means it's just white and thick. And this here says like a gray gelatinous. So it's very thick mucus and a cough and a lot of that comes out. And this is good for tuberculosis, of course. So yeah, there should be blood in there, but doesn't say that. Crushed pain in right testicle. So the right testicle has this crushed pain feeling. Seminal emission without sex desire or erection. So without sex desire, that's a 3. They get these emissions, and they have no erection with it or no desire, but they just get seminal emissions. Inflamed prostate. So this could be a medicine consider for the prostate being inflamed. Argentum Metallicum. Dry feeling through tongue, though it's moist. The tongue's moist, but it feels dry. Stomatitis, which is, and gingivitis. Stomatitis is sores in the mouth. Gingivitis, of course, we know is the gums are spongy and have a problem, and that could be mercury symptom. Copious flow, exhausting with sneezing. So a lot of mucus just coming out of the nose, and they're just sneezing away, and they have a nosebleed when blowing nose. Nostrils are blocked, so that's rhinitis, chronic rhinitis with that blocked nose. Polyps, they have polyps in the nose, and lupus, which is the immune system attacking that area. Vomiting during stool. Stools are soft, pass several times in a day. And don't forget, they feel like there's a worm crawling out of their anus. nervous itching and crawling and tickling and burning sensation over the body. There's no need to scratch though, so that's very interesting. Usually when you have this tickling and burning and all this itching, it's nervous. It's a nervous situation. You know, a lot of nervousness and worry with this whole medicine, but they don't need to scratch. Rosy pityriasis, which is just a rash, and the rash has a large spot with a bunch of little spots around it. So that's that pityriasis. And nodules, prurigo, that's what that is. Nodules, so nodules on the skin. Senile pruritis, which is itching when the weather changes. Any change of weather from hot to cold, cold to hot, they get itching in their skin. Sleeping sickness, so this person always feels like they want to sleep, and they get electric shocks when they sleep. They jump because they get these like electric shocks, and nausea during sleep. Burning ascends to the chest. So that's from the stomach. They get that whole distension and rumbling and stuff going on in the stomach, and it feels like it's burning down there, and that rises up into the chest. Anxiety and pressure in the stomach, appetite increased or repugnant. So they either have a great appetite and they, you know, even after they eat, they still feel hungry, or they just don't want no food. So it could be either or, and that could be depending on what stage. Like I said, you know, you have layers that go on, and then, like I said, you have stages to each sickness. You know, like I said, Nat Murr is very prim and proper, and the later stage, they're naked, run around, you know, with no clothes on, no, yeah, they don't have none of that anymore. So this could be a stage where, you know, early stage they might have a great appetite. Later stage, it may be, you know, they don't want any food at all. So, but the whole idea with this medicine is a lot of anxiety and worry, especially about the health, and just, you know, any businessman or woman or, you know, family member that has, just anybody having a lot of anxiety and worry, especially about health, Argentum metallicum would be considered. All right, high temperature between 11 a.m. and 1. So it's very interesting that uh, the symptoms are worse 3 to 6 p.m., but the what was it, the 11, where the heck was you, what was it, 11 or something, I can't remember where that was. There was another one here that's had a different time that was things would come on. Oh, I think it's the fever at noon. There it is, hectic fever at noon. So that can be within the 11 a.m. to 1 p.m. Time frame. So this hectic fever can come on there. That high temperature comes on anywhere. They say noon. If it's exactly noon, you'd probably go right to Argentum metallicum. But anywhere from 11 to 1, they get that high fever, and this would be the medicine you would consider silver. Fever of cold and shivers day and night. So they have these, you know, and if you know anybody has this like hectic fever, the fever comes on and they got chills with it, you know, so that's day and night. Now that can be in a flu, you know, whatever kind of cold, or malaria, cold, flu symptoms. So we basically don't go by the disease. Oh, this disease, you need that medicine. That isn't the way it works. Whether it's a cold, a flu, a COVID, you know, an injury, you know, to the head. They could have fevers and stuff with injury to the head. But anyways, you know, we look at the person and match their vital force to the symptoms of the medicine rather than to the disease. Now, knowing what they have can help. You know, it can help direct you a little bit, but it also can throw you off, because as we, just like symptoms can throw you off, you know, you're going for, and like I said, my wife's foot, Ruta, right away, as soon as that I'd seen that nodule on the bottom of her foot, Ruta came to my mind. I started giving it to her, and I had her on her for a little while, but it was just in bottles of water. When I told Tony, I said, yeah, I gave it to her for about a month, and he's like, that's interesting, but I wasn't giving her a new dose of the pills. I was just giving it in water. Now, I have to say, you know, I don't know what their experience is, but, you know, from reading Robin Murphy and the Oregon and all that, they basically talk about things in water. And I've experienced it. I just talked to my buddy yesterday. I feel bad. I wish I'd have started with his stroke with an arnica. That might have cleared it up, because arnica's for any head things, and a stroke basically has that sting and causes the paralysis and that. I went with causticum because that was left-sided, or was he right-sided? Left-sided paralysis. So I went with causticum, and I gave him to him so much. Now, does bottles of water work, or should you really be going with the tablets? Let me tell you, I had that guy taking causticum in a bottle of water, right? When he ran out, I told him fill it up with pure water, clear water, not from your, what do you want to say, tap. Sorry, not from your tap. I'm just, I've got that news on that guy had a head injury from football and said that's why he went down and shot all these people. I'll get to that in a minute. But I gave it to him in water, and he'd pound it and sip it, pound it and sip it, and he kept doing that. And eventually it was causticum, so there's burning with that. And he said his anus started burning, so he discontinued, and he won't take no medicine no more. And if I would have started with arnica, that could have totally cleared it up. But I went with causticum because that left-sided paralysis, I was hoping to get rid of it. But all he was doing, he wasn't taking new tablets of medicine or anything. All he was doing is he was taking a bottle of water, pounding it and sipping it till it was all gone, and then he took more clear water, pure water, pounded it and sipped it, and kept going like that for, I don't know, a month or so, and then he got burning in the anus. So most would say, oh, that's just a bottle of water and there's nothing left. Well, I'm telling you, those bottles of water, if you continue to do that and you don't, the bottle of water will go rotten, of course. So I gave him a bottle of apple cider vinegar and said, keep putting that in there, to keep the water good. But that proved to me that these bottles of water can continue to work no matter how far you dilute it out. And when I did the case taking stuff, and we were talking about, well, I don't know if I talked about the LMs and that, but that's when he went into water, and he would say he was doing it for hypersensitives. So he would take a little, he would make up the medicine in 4 ounces of water, a lot of water. Not a lot, but anyways, half a bottle. I think they're 8-ounce bottles, but anyways, it would give that medicine in the water. Then he said take a teaspoon out of that, put it into another 4 ounces of water, and take it and do it again and again. And he would dilute it so far out so that when that person took it, they would not get no aggravation. So that's what he was trying to get rid of, the aggravation. So that just tells me that these bottles of water can be, when they're potentized, have a potentized medicine in them, they can continue to be used and they will continue to work and react, So, and that's why I say that guy, he proved causticum. He started to prove causticum. I didn't. I said, that's it. Stop that medicine. And I wanted him to go back to the other one, but yeah, he wasn't doing it at that time. So when you give these medicines, and the other thing that, like I was talking to Tony, I said, sometimes we give a medicine and it helps, or it isn't working yet. It isn't working yet. We know that's the indicated remedy. I know Ruta should work. And then I started considering Russ Talk, same family, same idea, but you're not seeing the results you want totally, so you'd switch to another medicine. Now, I did get rid of the pain in her legs with calc carb, and then I used phosphoric acid to get rid of the pains. Now, that phosphoric acid and calc carb, like he said, could be like give it once a month. That could be or calc, calc phos. Phosphoric acid and calc phos. Anyways, calc phos I would give once a month. Then I would start with Ruta in the morning maybe, and then Russ Talks at night, and keep doing that for about a month and going with a low dose. And it seems like all these high doses and that, it seems like those low doses seem to work better over a longer period of time for whatever reason. So I'm going with a 3C Ruta. And then I don't know, Russ Talks, I don't think I have a low Russ Talks. I might just go with Ruta for now and keep going with Ruta. And then, if her pains in her legs come back, give her Russ Talks, So we'll see. But, I always give everything I have in a bottle of water. It makes it milder and it can work deeper. So, fever and cold and shivers day and night. There's that hoarseness. That's a 3. They have hoarseness in their throat. Worse from use of voice. So that's a 3. And they have gray jelly-like mucus. That's a 3. Profuse, easy expectoration in the morning. That's a 3. So there's a lot of throat stuff with this medicine. A 3 for hoarseness, worse using of voice, gray jelly-like mucus, and easy expectoration in the morning. Vertigo on looking at running water. So anytime they see water moving, I would even think, like my dad, he said he'd take us to the, the rides, the parks and that, and he would have to put his head to the wall because he could not watch that thing spin. So running water, spinning tops, or spinning rides at an amusement park, I would think the same thing. And they feel intoxicated. They feel like they're drunk, with that vertigo. So with this medicine, there's a lot of weakness in the chest, feeling of pain, a rawness in this up above in the sternum, sternum fossa, which is that triangle part of your neck. Let's see, the cervix, menopausal stuff, leukorrhea, a lot of menopausal things, great hunger, nausea with that hunger. Their head feels empty, palpitations in the heart, profuse urination. Ankles are swollen, could be a diabetes thing. And when they laugh, they cough. So there's a lot of coughing and emissions, second seminal emissions from sex drives. And they're always anxious about their health, very anxious. Very much bones, joints, and cartilage, rheumatism, a lot of that going on with this person. So they got a lot of joints, good for the tissues, the joints, and all that kind of stuff. So, all right, let's see. And then you differentiate. You take a medicine like this and you would do some differentials. What is a differential? Well, that is, one likes warm, one likes hot, one likes cold drinks, one likes none. One's hungry all the time, the other one isn't. So you would be trying to determine between those medicines which one matches best. And the better you match it, the better off the patient will be. The muscular symptom is also affected with cramps in limbs. Calves feel too short on going downstairs. So when they go downstairs, it feels like they're just, their legs are too short, the calves. Stiffness, numbness in those legs. Electric-like shocks in joints and limbs. That's what wakes them up at night. Painless twitching. So they've got a lot of twitching in their muscles and that. So a lot of muscular, like I said, joints, bones, cartilage, muscles, nerves, a lot of that for this Argentum metallicum. The heart is especially affected. Frequent spasmodic, though painless. So you got spasmodic heart action, but it's painless. Twitchings in the whole heart muscle. So it's painless, but there's a lot of twitching in the heart muscles. Worse, lying on back. So when they lie down on their back, it gets worse. Fears having a stroke. So their fear, that's where that anxiety about the health comes in. Sensation as if heart stood still, followed by trembling, then irregular violent throbbing. Palpitations at night during pregnancy. So a lot of heart stuff going on. Palpitations, feels like it stopped, then it throbs, so there's a lot of twitching of the heart muscles and everything going on. In society, disinclined to talk, so they just sit back, they won't say much. Discouraged, they're discouraged. Reaction from this, great inclination to talk, mind very clear. So when they're in public, they don't want to talk, they sit back, but then when they're alone with one person or something, they're just loquacity, which is a lot of talking. Frontal headache of businessmen or women or anybody that has a frontal headache, and that's from worry. Headache increases gradually and ceases suddenly. So there's another medicine I know that things come on. What is that medicine? Comes on gradually and release suddenly. No, that one is comes on suddenly, release suddenly. But this one is the headache increases, and then leaves. At acme as if a nerve being torn, usually the left side of the head. Sticky saliva and mucus expectoration, which is easy to remove from the mucous membranes. Generally, there is a secretion like boiled starch, or there may be thin. It may be thin and at the same time a thick yellow or greenish discharge. Great hunger even after a full meal. Extreme dryness of mouth, tongue sticks to palate. Even though the tongue's moist, this symptom, which the polyuria points to diabetes. So that dry mouth points to, and a lot of urination points to polyuria in diabetes, in which Argentum is particularly indicated. If there is swelling of the ankles, so swelling of the ankles has got a lot to do with the diabetes and all that, mellitis, diabetes mellitus. Spasmodic bedwetting at night, effects of onanism, which is masturbation, impotence, atrophy of penis, bruised pains in testicles, pains in left ovary, feels enormously swollen. This with this prolapse of uterus. So the ovary feels swollen and they have prolapse of uterus. I'm over now. Metallicum, large lumps with violent pains, worse by every motion. Argentum metallicum acts more on the left side than the right. Left ovary is affected. Prolapse of uterus with pains in left ovary. Juvenile diabetes, which of growth in bones. Juvenile disorders of growth in bones, fracture of hip of the second metatarsal bone, fracture of the scaphoid and tarsal bone. So a lot of bone stuff there. Fracture of anterior tibia, deforming arthritis of the hip, vertebral, the vertebrae, arthritis. So arthritis in the vertebrae, tenderness in prominent is prominent in Argentum metallicum, tearing pressure and pains in the bones, joint rheumatism without swelling, parts feel bruised when pressed on. Hoarseness of singers and speakers, where speaking or singing, laughing causes cough, restless sleep, electric shock through body wakens her. Okay, that is morning medicine. You can age, but you don't have to get old. Went over by a minute or so, minute and a half. And